Hi everyone, so today we're going to talk to you about an important concept that we use to guide our loading progressions, and that's using past injuries to help us understand how we're going to deliver load to the anatomy and how quickly we're going to progress from proximal to distal, because we're going to look at this within the context of low back pain. With two case scenarios. So case scenario one is a client with a sudden onset of low back pain who went on to get surgery at the lumbar spine. His or her past injury, or past treatment history, I should say, consisted of core stability and pelvic stability strategies, and there's no change in their symptoms. Client number two, or case number two, involves a client with low back pain, a current experience of low back pain, but there was more of a gradual onset. And when we dig into their injury history, they don't have any direct injuries at the lumbar spine or at the low back, but they have a long injury history across the lower limb, multiple ankle sprains, multiple knee injuries. Okay, so the location of those past injuries will have an influence on how we deliver load to the system and what kind of influence that is going to have on the experience of pain at the lumbar spine. Because ultimately, that pain is a top-down protective strategy from the nervous system. And what we need to try to do is we need to reduce the need for pain as a protective response or a protective strategy. So we're almost trying to prove to the nervous system that our anatomy has the capacity to manage force as well. So we need to identify where the limitations are. And so within our assessment approach, we're always assessing qualities and capacities from proximal to distal. Okay, regardless of where the chief complaint is, regardless of where the client is experiencing pain, we're always looking at qualities from proximal to distal first to get a picture of the midline versus the limb in this low back pain scenario, for example. From a rehab standpoint, we're always loading the anatomy from proximal to distal as well, but we're loading the anatomy from proximal to distal with the intention of improving distal to proximal load sharing qualities, because it's ultimately the distal tissues that directly interact with the external environment. They need to take on a specific behavior to manage those forces, which gives the proximal structures the capacity to express more variability. Because when you look at the spine, a lot of segmentation, this is a body region that is meant to be variable, that's meant to be adaptable, that's meant to have a wide scope of movement options. Okay, so let's say we have the clients in front of us with a current experience of low back pain. Okay, if we're working with a client, and again, looking at past injuries obviously is not the only thing that's going to influence your loading progressions, but again, it can be really helpful to get the client and push the client in the right direction. Okay, or at least kind of work on, help us understand the entry point of loading and then how we're going to progress overall. So if we're working with a client with an injury history proximally at the lumbar spine, we may have to look more closely at the interaction between the rib cage and pelvis early on, because ultimately the behavior of the lumbar spine is a reflection of how the rib cage and pelvis are interacting with one another. So when the rib cage flexes, when the pelvis extends, that will allow for a flexion of the lumbar spine. When the rib cage extends, the pelvis flexes, that will allow for an extension of the lumbar spine. That's obviously just looking at it within the sagittal plane. But again, we might have to put more focus and direct more tension proximally first before we move distally. So we're going to move distally much more slowly in this scenario, because we have experienced situations where we are dealing with a client with a pain experience in the lumbar spine, with an injury history proximally at the lumbar spine, nothing distally. And when you progress load into the distal tissues too soon, sometimes that can increase the threat in the system, because the nervous system is not ready to direct that load or distribute that workload into the limb. It's too busy protecting the lumbar spine. Okay, so we need to improve the load sharing qualities locally first around the lumbar spine before we move into the limb and improve that distal to proximal, those distal to proximal load sharing qualities. If we look at scenario number two, again with a gradual onset of low back pain with more distal injury history, and received a very similar prior treatment plan with core stability and pelvic stability strategies. No consideration given to the unique injury history of each client, which is very common in a physical therapy setting. Just give each client similar strategies to work on, which is obviously not going to help address the unique limitations of each client. In that client scenario, we may not have to, we may still have to work on the local interactions proximally between the rib cage and the pelvis to influence what's happening at the lumbar spine, but we may have to move distally much faster to improve the low capacity of those limitations distally. Because often what we see clinically is that a lack of capacity distally in the ability to manage forces and distribute forces will potentially lead to an increase in muscle activity or a change in the behavior, a reduction in movement options proximally. So sometimes even if we have a client with a lot of limitations proximally at the midline, but with no injury history there, but with an injury history distally, what you're seeing proximally, the limitations you're seeing proximally, is ultimately a reflection of a result, we should say, of poor load sharing qualities distally. Okay, so in that scenario, we still work proximally to distally, but the speed at which we progress from proximal to distal will be much faster in that scenario. The speed at which we progress from proximal to distal in the case number 1 with more with the injury history proximally at the lumbar spine will be much slower. Okay, so it's a really important concept to consider, the location of past injuries and how that's going to influence your loading progressions, but it's something that we feel as though is not given enough credit when it comes to how we're actually going to restore robust movement qualities in our clients.